Hello, everyone. My name is Hannah Farrar. Today I'll be presenting a comparison between the healthcare systems of Switzerland and the United States. I'll highlight the strengths of Switzerland's model and suggest ways the U.S. could improve its healthcare system based on these findings. Despite spending more per person on healthcare than any other country, the United States has poor outcomes in areas like expectancy and mortality rates. Switzerland, on the other hand, spends less but achieves better results in this presentation. We'll explore why and how the U.S. can learn from Switzerland's example. Switzerland's population is approximately 8.9 million people. The country is culturally diverse, with about 85% of the population being white and smaller percentages of being Black, Hispanic, and Asian residents. Life expectancy is around 83 years, one of the highest globally reflecting Switzerland's strong overall health. The United States has a much larger population at around 332 million people. The ethnic makeup is more varied, though, with about 59% white, 19% Hispanic, 14% Black, and 6% Asian. The life expectancy in the U.S. has declined to around 76 years, impacted by factors like COVID-19 and then also chronic diseases. Switzerland's mortality rate is about 7.9 deaths per 1,000 people. The country has low morbidity rates thanks to strong focus on preventative care, healthy diets, and low smoking rates. Over 81% of Swiss residents report being in a good or very good health. In contrast, the United States mortality rate is higher at 10.4 deaths per 1,000 people. Chronic diseases, poor diet, smoking, and limited access to affordable healthcare contribute significantly to higher morbidity rates and mortality rates in the United States. In Switzerland, the top causes of death are ischemic heart disease, Alzheimer's disease, and COVID-19. The most treated illness includes diabetes, hypertension, and mental health disorders, which is managed early throughout preventative care and healthcare programs. Similarly, the United States' leading causes of death are ischemic heart disease, COVID-19, and Alzheimer's disease. However, rates of these conditions are significantly higher compared to Switzerland, largely due to the lack of early intervention and widespread preventative care. Switzerland operates a private mandatory health insurance system. Citizens must buy basic insurance, but if premiums cost more than 8% of their income, government subsidies help cover the difference. Everyone is accepted regardless of their age or health status. Healthcare is delivered through a mix of hospitals, primary care doctors, and outpatient clinics, ensuring broad and efficient access. The United States has fragmented healthcare systems made up of employer-based insurance, government programs like Medicare and Medicaid, and a large uninsured population. Access to care often depends on employment, income level, or state residency. Many Americans either lack insurance or underinsured, leading to disparities in care. In Switzerland, funding primarily comes from individual insurances, premiums with government support for low-income citizens. In the United States, healthcare is funded through a complex mix of private insurance, employer contributions, and government programs. However, out-of-pocket costs in the U.S. are much higher, often leading to medical debt and delayed care. In Switzerland, all residents must have insurance and coverage is guaranteed. In the United States, there is no universal mandate for healthcare insurance anymore. Coverage often depends on employment or qualifying for government aid, leaving in millions without insurance or adequate coverage. Both countries use a mix of public and private hospitals. However, Switzerland places stronger emphasis on primary care, preventative services, and short wait times. In the United States, a shortage of primary care providers and high costs often drive people to rely on emergency rooms for non-emergency issues. Switzerland achieves better health outcomes at lower overall costs by requiring universal basic insurance, controlling out-of-pocket expenses, and investing heavily in preventive care. The United States, while spending more, struggles with inefficiency, inequality, and poor outcomes. to address these challenges, I propose two solutions. First, the United States should enact universal basic health insurance with income-based subsidies to ensure everyone has affordable coverage. Second, the United States must significantly expand preventive care programs. This includes early screenings, public health education, and better access to primary care providers, all of which could lower long-term costs and improve outcomes like how Switzerland does. Switzerland provides a proven example that universal coverage and preventative care leads to a healthier population and lower costs. If the United States can adopt these similar reforms, we could achieve a healthcare system that is more equitable, affordable, and effective for all Americans. Thank you so much for listening to my presentation.